guys, welcome back to Army in White. In the last videos we have talked about pneumothorax, that is one of the topic from the respiratory pathology, and today we will be talking about another topic from respiratory pathology itself, that will be cystic fibrosis. It is one of the important topic. Okay, so let's go into the topic and let's see what are there. क्या था कि ये most common inherited disease for the white population. Okay, ये क्या था most common inherited disease for the white population, autosomal recessive disease. So no sex chromosome are involved, autosomal, and it is recessive. Okay, both the allele should be mutated. It is very much common in the white population, that is the ratio will be 1 in every 3000, in the black population 1 in every 15,000, and in the Asian population 1 in every 30,000. Okay, it is the most common inherited disease in the white population. Those white population means the descendant from the North European people. Okay, in autosomal diseases. Let's look further what are there. इसमें क्या है कि mutation on both the chromosome leads to cystic fibrosis. हाँ, इसको पता ही है क्योंकि ये क्या था, recessive disease था ना. recessive में क्या होता है कि mutation both the chromosome में होना चाहिए, both the chromosome, सिर्फ एक में होने से नहीं होता क्योंकि ये डोमिनेंट नहीं है. ओके, एंड विच क्रोमोसोम इज इन्वॉल्व? सो क्रोमोसोम इन्वॉल्व इज द 7th क्रोमोसोम इज इन्वॉल्व. ओके, सॉरी, 7th क्रोमोसोम इज इन्वॉल्व in the cystic fibrosis. 7th chromosome is involved. When we want to know the exact location where and how it happened, exact location will be at midsection of the long arm of the 7th chromosome. Where? In the midsection of the long arm of the 7th chromosome. Okay, it's a, suppose these are the chromosome, these are the long arm, and these are the short arm. Okay, in the long arm, in the midsection somewhere here, there will be mutation that is on the 7th chromosome. Okay, this is the 7th chromosome, and see here it is written very clearly, that is 7q31.1.1. that means 7th chromosome. Q means the long arm, Q means the long arm. Okay, this is Q is the long arm, and 31 means 3 will be the region where it is the third region, and 1 here is represent the band, and 0.1, that is dot 1. After the dot, the 1, this will represent the sub band. Okay, so please look here, I will be writing one more time. 7th chromosome in the long arm, in the third region, in the first band, in the sub band it will be the 1 again. See, like this. So if you want to know the exact location in where in which location of the 7th chromosome it is mutated, you can say in the long arm, that is Q31.1. okay, so this is very important. So I would like to highlight one more time. See, 7q31.1, that is 7 long arm of the 7th chromosome in the 31.1. just remember that. And the gene involved, what is the gene involved here? The gene involved is the CFTR gene. Okay, cystic fibrosis transmembrane conductance regulator. So just mark up, I'll explain you in the later portion. The gene involved is CFTR, cystic fibrosis transmembrane conductance regulator. Okay, and what is the chromosome involved? 7th. Which location? 7 long arm, that is 7q31.1. okay, long arm of the 7th chromosome. So in the CFTR mutation in both the copies of the CFTR leads to cystic fibrosis. We all know that it is recessive, so mutation should be on both the copies of the CFTR gene. Okay, so in normal condition what will happen? Okay, let's look in the normal condition now how CFTR function, and why mutation in CFTR can leads to cystic fibrosis. Okay, so the picture here will be showing you the epithelial cell in the lung. Okay, I will be explaining you. So let's first look some written part here. CFTR gene from epithelial cell throughout chloride. Along with it, sodium cannot go into the cell, and sodium also retain in the surface. Okay, see here in the picture, please. In the picture, in the picture here, see, this is the epithelial cell of the lung. Okay, this is the epithelial cell. So what this will do is that in the normal person we are talking about. Okay, from here the chloride will be coming out. The chloride will be given out by the epithelial cell. So once the chloride is given out, the sodium from the nearby channel, there will be a nearby channel here, the sodium is to go inside the cell, but once the chlorine goes out, this will be inhibited, so sodium will also be retained in the surface itself. Okay, see here, there will be lots of sodium. So once the chloride and sodium are here, it will trap the water from the surroundings. See, this water is 2O here are already trapped here. So all this green color here, these are the mucus secreted by the epithelial cell. So we all know that when there is water in the mucus will become thin. Okay, see here. So sodium and chloride together hold water and make the secreted mucus thin. Okay, so this mucus will become more thin because of the presence of water. Now the cilia, we all know that in the respiratory pathway there will be different cilias. Cilias of the epithelial cell of the lung always beats towards the larynx. Okay, suppose this is the larynx, so it will always beat towards the larynx, towards this direction. Suppose this is the mouth here and down here, so just know that it beat toward the larynx, and the mucus will be going up in the larynx and it will get swollen down to the stomach, which is very high acidic pH. We know that there is very acidic environment in the stomach. So now this mechanism is known as mucociliary clearance mechanism. Okay, so cilia of the respiratory epithelium always beats towards the larynx और ट्रैकिया, है ना, ऊपर बीट करता है तो ऊपर जाके क्या करता है, हमारा गट में चले जाता है. गट में क्या होता है कि हाई एसिडिक इन्वायरमेंट में वहाँ जाके क्या होता है, उसका डाइजेशन हो जाता है. तो ये जितना भी हमारा क्या होता है, जितना भी हमारा फॉरेन पार्टिकल माइक्रोब जितना आता है, तो वो सब क्या करता है कि डाइजेशन हो जाता है स्टमक में जाके, क्यों, विद द हेल्प ऑफ म्यूकोसिलरी क्लियरेंस मैकेनिज्म, विद द हेल्प ऑफ म्यूकोसिलरी क्लियरेंस मैकेनिज्म. ओके, दिस इज वेरी इंपॉर्टेंट इन हेल्दी पर्सन, इट हैपेंस. सो सपोज ये लंग है यहाँ, ये लंग का रिप्रेजेंटेटिव डायग्राम है. तो ये क्या होगा कि जब ये ऊपर पार्ट में अगर समथिंग हैपन हियर इन द अपर पार्ट, this will be helped by the mucociliary clearance mechanism. Okay, but what if there is some problem here down? What if there is problem here? There cannot be mucociliary mechanism. Okay, but here it will be helped by the macrophage is present here. So macrophage will do its function here. So macrophage will destroy everything. If microbes or foreign particles are on the distal part of ये distal part में हो गया तो क्या होगा, no mucociliary clearance mechanism, but macrophage is present here. So macrophage काम कर लेता है. Sorry, let's look in one picture that I have prepared for you guys. See, यहाँ देखते हैं इस पिक्चर में, ठीक है ना. ये हमारा क्या है, ये हमारा सेल है. यहाँ से CFTR जीन होता है. CFTR जीन क्या करता है कि हमारा प्रोटीन सिंथेसाइज करता है. प्रोटीन सिंथेसाइज करके एंडोप्लाज्मिक रेटिकुलम के थ्रू से हमारा क्या करता है, ये ट्रांस मेम्ब्रेन डोमेन में देता है, और यहाँ से क्या करता है कि यहाँ से क्लोराइड सीक्रेट करता है. सो वंस क्लोराइड सीक्रेट होते समय क्या करता है कि हमारा ये जो क्लोराइड या सोडियम चैनल है, सोडियम चैनल को क्लोज इनहिबिट करता है. सो सोडियम चैनल को इनहिबिट करते समय क्लोरीन एंड सोडियम टुगेदर यहाँ आ जाता है. तो ये क्या करता है, ये लोग वाटर को ट्रैप करते हैं. वाटर को ट्रैप करके म्यूकस जितना भी सीक्रेट कर रहा था ये सेल, जो म्यूकस जितना भी सीक्रेट हो रहा था, इसको थिन करके म्यूकोसिलरी क्लियरेंस मैकेनिज्म में हेल्प करते हैं. ठीक है, वी विल बी लुकिंग दिस पिक्चर वंस अगेन व्हेन वी आर एक्सप्लेनिंग थिंग्स. सो म्यूटेशन क्या होता है, म्यूटेशन, व्हाट इज म्यूटेशन? ओके, लेट्स डिफाइन म्यूटेशन नाउ. म्यूटेशन हियर फॉर द डेफिनेशन फॉर बेटर अंडरस्टैंडिंग, परमानेंट चेंज इन द जेनेटिक मटेरियल. क्या है परमानेंट चेंज इन द जेनेटिक मटेरियल? कहाँ होता है चेंज जेनेटिक मटेरियल में? दैट कैन बी पास टू द नेक्स्ट जनरेशन. सो म्यूटेशन अगर हो गया तो फ्रॉम वन जनरेशन टू नेक्स्ट जनरेशन पास होता है. सो म्यूटेशन मीन्स परमानेंट चेंज इन जेनेटिक मटेरियल दैट कैन बी passed from one generation to the next generation. Okay, so in the first case, let's look what are the different types of mutation present in cystic fibrosis. Mutation can be at promoter region. So see, in the first region, the promoter region of the gene, you know, the rate of transcription will change. That will be either increase or decrease. This is called the class 1 mutation, that is splicing defect. Okay, what type of protein will be formed? Garble protein will be formed. Okay, this is the most common type of mutation in cystic fibrosis is class 2 type of mutation. Okay, there will be class 2. I will explain what is class 2 type of mutation. In this, the 3 base pair mutation deletion will be occur. 3 base pair nucleotide deletion will be occur. That is, in 70% of the cases, in 70% of the patient, 3 base pair is missing from the special place. So special place, let's look what is the special place. In 70% of the patient, phenylalanine from 508 is missing. कहाँ से? 5, this is very important. Okay, from 508, what is missing? Phenylalanine from the 508 is missing. This is known as class 2 type of mutation. See, this is known as class 2 type of mutation. The protein goes to the endoplasmic reticulum. See here, क्या होगा ना, इसमें क्या होगा कि यहाँ से क्या होता है, यहाँ से आता है, लेकिन क्या है कि 508 पोजीशन से फिनाइल एलेनिन नहीं है, तो ड्यू टू एब्सेंस ऑफ फिनाइल एलेनिन दिस विल बी मिस फोल्डेड. ओके, हियर क्या होगा, मिस फोल्डेड. हमको सबको पता है ना कि प्रोटीन शुड बी फोल्डेड इन ए वेरी रेगुलर फैशन, जो उसका एक प्रॉपर तरीका होता है. इफ द प्रोटीन इज नॉट फोल्डेड प्रॉपरली, देयर विल बी डिस्ट्रक्शन विद इन द एंडोप्लाज्मिक रेटिकुलम और बाय लाइसो इन द लाइसोसोम्स. ओके, सो दिस बिफोर रीचिंग here, this should be reached here, and the chloride should be released. This, with the release of chlorine, this should be inhibited and mucociliary mechanism should be in a proper way. But once this type of protein is synthesized by the CFTR, here it will not be folded properly. So once it is not folded properly, it will be destroyed here, so it cannot reach here. So protein will not be reaching in the transmembrane domain. Okay, सो ट्रांसमेम्ब्रेन डोमेन नहीं पहुंचता है, तो क्या होता है कि फिनाइल एलेनिन जब एक बार मिस हो गया 508 पोजीशन से, तो देयर विल बी a problem, and that mutation is called class 2 type of mutation. Okay, this misfolded or mutant protein cannot reach to the membrane, instead destroyed at the Golgi apparatus, that is the Golgi body यहाँ लिखा है. So the most common type, this is the most common type of mutation. Okay, in the next one let's look what is the class 3 mutation. Class 3 mutation bring alteration at the NBD मतलब न्यूक्लियोटाइड बाइंडिंग डोमेन. ओके, यहाँ ये पिक्चर में देखते हैं, न्यूक्लियोटाइड बाइंडिंग डोमेन ये होता है, ठीक है ना. न्यूक्लियोटाइड बाइंडिंग डोमेन ये होता है मेम्ब्रेन का. यहाँ से from the beginning good protein is synthesized, it is folded properly, it is going out of the endoplasmic reticulum, but due to the problem in the NBD, nucleotide binding domain here, it cannot be bind properly, so the problem will be, again there will be a problem. Okay, that is problem with the NBD. Here synthesis of protein is good. See, synthesis of the protein is good, transport also good, but the problem is at NBD, so function poorly by NBD. This is quite less in clinical problem, but it's also a problem, no. And let's look what is the fourth class. Okay, the fourth, what do you say, class 4 type of mutation is at the transmembrane domain. ओके, ट्रांसमेम्ब्रेन डोमेन सबको पता है ना, सबसे ऊपर वाला ये, सबसे ये ट्रांसमेम्ब्रेन, ये हमारा मेम्ब्रेन था, तो ये ट्रांसमेम्ब्रेन डोमेन. अगर ट्रांसमेम्ब्रेन डोमेन में ये ट्रांसमेम्ब्रेन डोमेन अगर काम नहीं करेगा, तो क्या होगा कि ये क्लोरीन चैनल को ओपन नहीं करेगा. क्लोरीन चैनल ओपन नहीं हुआ तो क्या होगा, बाहर जाके क्लोरीन नहीं जाएगा, सोडियम नहीं जाएगा, तो वो क्लियरेंस मैकेनिज्म नहीं हो पाएगा. सो इस हियर व्हाट इट सेज इज दैट हियर द क्लोरीन चैनल विल नॉट बी वर्किंग प्रॉपर्ली. इन क्लास 5 म्यूटेशन at promoter box, total number of mRNA will be less. So promoter box में, so this is known as reduced abundance mutation. Okay, it is when we look the severity of the mutation, which class is the most severe, class 1 and class 2 type of mutation is the most severe one. Okay, class 1 and class 2 is the most severe one, and another 3, 4 and 5 is quite milder one. So in the next video we will be talking more about cystic fibrosis, and I hope this will make you clear. If you want, if you have any questions or any queries regarding this topic, cystic fibrosis, please write down in the comment section, and I will be very happy to help you out. Okay, so the most important thing is that you need to look in exam point of view, this autosomal recessive disease. Okay, 7th chromosome involved, the long arm of the 7th chromosome. CFTR gene is involved in the cystic fibrosis. CFTR, okay, cystic fibrosis transmembrane conductance regulator. Okay, and you have to understand very well about the mucociliary clearance mechanism, and once you know the mucociliary clearance mechanism of a healthy person, you will understand with the impairment of this type of mucociliary clearance mechanism how cystic fibrosis will be occurring. Okay, so hope this will help you understand cystic fibrosis more better. Thank you guys, and please like, share and subscribe. Thank you.